Thank you both. All right, I'm going to keep us moving and turn to our medical oncologist. This is a very nuanced question. Let's say a patient has EGFR classical mutation, metastatic non-small cell lung cancer, and they're on single agent osimertinib. And they're on osimertinib, unfortunately, have disease progression. What is the best option? Osimertinib plus ADC, osimertinib plus chemo, or osimertinib plus radiation therapy? And how do you make that option?
Did you say progression after osimertinib or first line?
Progression on osimertinib. Are you choosing osimertinib plus ADCs, osimertinib plus chemo, osimertinib plus SBRT, anything else?
There is no approved osimertinib plus ADC unless they're referring to Dato-DXd, which is approved after chemo as single agent, not in combination with osimertinib. There are some trials for osimertinib plus ADCs after progression on osimertinib, such as Tropion Lung 15, and of course there are some others. But it's really case by case. I'm interested to see what Dr. Patel has to say, but it's really case by case because whenever a patient progresses on osimertinib, I'm always interested to biopsy or at least send a ctDNA to try to understand the resistance mechanism that led to the progression on osimertinib. If it's something like C797S, which is a mutation that happens in the EGFR protein and leads to resistance on osimertinib, probably I'll stop osimertinib and use and move to a different modality, considering an EGFR inhibition such as amivantamab. But if it's a different mechanism of action, there are a lot of, or mechanism of resistance, there are some other things that you can do. So it's a case by case, but the options that we have, continuing OC, adding chemo, if it's a local or like an oligoprogression, we can send to Dr. Antonoff or Dr. Reichman for some local ablative therapies. We can consider adding chemo, consider adding AMI. There are a lot of options, but it's a case by case.
Thanks, Dr. Patel.
I would agree that it's case by case. I do try, if there is oligoprogression, to try and send them to our local radiation oncologist to radiate if it's only one lesion and continue them on osimertinib while looking for the resistance patterns to decide if we need to make a change to treatment.